Honorable Chairman, my first question, it is on the issue of the program dubbed as Linda Mama. This program used to facilitate free delivery by our expectant mother in this country. But right now it has been faced with quite a number of challenges, making women suffer, especially those who are expectant. I don't know if you're appointed, what mitigation measures are you going to put in place to ensure the Linda Mama program or a replica of Linda Mama program is enshrined so that our women will no longer suffer? My second question, it is about the rising mental health burden in this country, where some studies have shown that in every five people, one is suffering from health disorder. And this has been witnessed in our learning institution, especially in our universities, in our secondary schools, where we have seen love triangles cases, we have seen some suicide cases, some reckless killing, and so many other issues. And this issue is compounded by a fragile mental health system, socioeconomic challenges, and cultural attitudes. Given the existing mental health policies and action plans, what are the key challenges facing the mental health system? If appointed, what policies will you put in place to address these challenges? That is, the immediate, the medium term, and the long term. And also, is the mental health integrated in the UHC? My last question, Honorable Speaker. No, I have the last one. This is last one. The other time I asked only one question, Honorable Chairman. I just want to ask the last question. Kenya right now has a deficit in terms of doctor-to-patient population. Now with the government directives, which frees new employment and term wage bill, what strategy are you going to ensure that we have more health provided, and especially for those dealing with chronic diseases such as cancers, because we have few oncologists. Also in the mental disorders, we have few psychiatrists. What are you going to ensure that at least we have more specialized doctors? Thank you.
You followed 3 questions. Linda Mama, will you bring it back in its same form or another? What do you do with mental patients and mental health care? Okay.
Yes, through you, Honorable Chair, I'd like to address the concerns. I am a beneficiary of Linda Mama, and my daughter is a beneficiary of Linda Mama. And so I'm an advocate of it. And I will ensure that it's incorporated if SHIF is rolled out. Now, during the transition period, at times such activities may, fall through the cracks, but funds have been allocated from the discussions we were having while I was in WHO with the national team. So we need to have a transition plan or guidelines to ensure that some of these critical covers like the Linda Mama are always there when we are transitioning. So this is an area that we look to and ensure that all mothers and the children are covered. I will combine the mental health and doctors to patient population. Indeed, this is not just the doctors, but the health workforce in general. We need to look at how we can protect them and how they can grow in their career. And so I will engage the universities and other training programs such as the Eastern Southern College of Physicians, the surgical programs, the obstetrics and gynecology programs, and have deliberations on other programs that we can have in the country for our health workers to progress in their career, because we can have even clinical officers, nurses specializing in mental health, in matters oncology, among others. Equally, it is critical, again, as I said earlier, to strengthen the community health programs and the primary care networks with mental health specialization or professionals that have been trained in mental health. And so these are areas that we can look into addressing.
Sharia.